Hello, my name's Hannah and I'm going to discuss with you today the results of an analysis that I carried out to do with flu season in North America. Here we have a Tableau storyboard which summarises my findings. So a flu season, a staffing plan analysis. With flu season occurring every year and putting a strain on medical staffing, the goal is to devise a plan that will cater for the increase in demand for staff. The diagram here represents when flu season is at its highest, and it's generally around the colder months, hence the representation of these months being in blue. And you can see that the warmer months, which are smaller, flu season isn't quite so prevalent. Flu isn't quite so prevalent. The task ahead is to categorise each state in America so that the states with the highest risk of death from flu can be a staffing priority. It is equally important to identify states at low risk to avoid possible overstaffing. An earlier analysis, which you would have seen in the interim report, revealed that regions with higher proportions of vulnerable individuals were subject to higher rates of death associated with influenza. So we took the data available, which was the death rate in North America recorded by each state from 2011 to 2017. The total deaths from this period were placed in this bar chart. The dark colour representing the total number of deaths and the lighter colour showing the number of deaths or the proportion of deaths from vulnerable groups. So you can see that those with high rates of deaths, California, New York, Texas, Pennsylvania, and Florida, and so forth, have a high proportion of deaths from vulnerable groups. Whereas when we go further down the list where there are lower rates of death, the proportion of vulnerable groups are more of a 50-50 split, so not specifically vulnerable groups. So a little note here saying that the contributory factors to death rate are population size and the levels of vulnerable populations. So what we need to look at next is which states have large populations and which states have a large number of vulnerable people. So taking the states of America as a geographical representation, the first map shows the average number of deaths per state, and the second map shows the average vulnerable population size. Now these first two maps have been split into three, low, medium and high, and we can see that the darker colours and the medium colours show 7 states in the first map and 6 states in the second map. Now the same 6 states have been identified as high priority in maps 1 and 2. So we can hover over any state in map 1 or 2 to show what these high priority states are. And if you remember from the earlier slide, California, New York and Texas were the top 3 also. Pennsylvania, Florida, Illinois and Ohio. The third map shows the percentage of deaths from vulnerable groups. And as you can see, the map shows a lot more colour. But what we can see is that there are several states, 12 in total, have been identified as still being pale in colour, which means at the other end of the priority list, we can see that all maps have identified 12 states of low risk. So if we hover over these lighter colours, we can see the 12 states have been identified as being at the bottom of the list and not needing an intervention with extra staff. We hope. So the same data was used to forecast the death rate for the coming year of 2018. And we can see from the top priority states that the forecast for 2018, the majority of the priority states did not show or showed that the death rate looked to remain steady. This is with the exception of New York and Texas, which show an increase of Texas 8.6% and New York 4.5%. A test was done filtering by other less or lower priority states at this stage, and most of them were shown to remain steady, so we can take that. The final slide. So the goal here is to not only provide staffing to manage workloads, but to also provide staffing intervention to help save lives, with the idea that the more staffing or the appropriate staffing levels can help to prevent death from flu. Looking at the scatter graphs, we compare the number of patient visits to the number of deaths, and the number of patients presenting with influenza-like illnesses to the number of deaths. And we can see that the trend line shows a correlation of 0.6. This is a moderate correlation, but that also means that there's over a third of people are dying from flu without the recording of any early warning signs. And what would be a further step would be to identify what's happened to these people, why aren't they getting recorded, and what can we do to predict these deaths that aren't being recorded. So essentially, more information is required in order to formulate an effective and accurate staffing plan. We want to do this on a per week basis by clinic or hospital and by state. And there are a number of areas that require further consideration. This word cloud shows details of that. So starting with the early warning signs, what indicators are there to help anticipate risk of death from flu? Which clinics and hospitals are to be included in this planning? What are the current staffing levels that are available? What are the temporary staffing levels that are available? And of those temporary staff, what are their skill levels? And what are their job roles? So how many doctors are available? How many nurses? How many healthcare assistants? We need to find out when are the busiest weeks in the various centres. And this is because we need to know on a per hospital or clinic basis, as per their requirements. We need to assign staff on a per week basis, and it needs to be per state. What other factors are available to help avoid influenza-related deaths? And how should the staff plan or the staffing plan be presented? So we have we've been able to ascertain the high priority lists. Let's go back to this slide. The high priority states, and we've been able to identify the low priority states. And there's 32 states in between where we need to assign them to a low, medium or high priority. So following the next steps, we hope to gather more information to create an accurate staffing plan. Thanks for listening.